With the surge that's happening right now, are you worried about elective surgeries being shut back down?
Yeah, I am. It's really interesting. Here, I brought this stat when I was fascinated. So Brian Piercy, who's our director of surgical services, he reports out to us just what our volumes are looking like. In the month of June, we performed 995 surgeries. It is a record for Kaweah Delta in our entire history. We generally, in a non-COVID period, average about 800 surgeries a month. We did 995. 55% of them were outpatient, 45% of them were inpatient. We still are trying to limit, the number of elective inpatient surgeries that we're doing, because again, we don't want to take up beds. But when we were hearing about, this backlog, we were hearing 800 backlog surgeries. That certainly seemed to be the case in the month of June. I sure hope that it translates into a positive margin for us, because we so desperately need it. But what's been very discouraging to hear just this week, as I've explained, there are many regulations at both the federal and state level that have been relaxed. They've been suspended, just to recognize that we're in unprecedented times right now. Allowing hospitals to use spaces in its hospital, for adults that may be like our pediatric unit. It's a 12-bed unit. It's been closed for probably well over a month, if not longer, because of the resurgence that we're experiencing here in Tulare County and at Kaweah Delta. Over this last weekend, we opened up that 12-bed pediatric unit and turned it into an adult COVID unit. Under normal circumstances, the state would have never allowed that, but they've relaxed those licensing regulations. There are very strict nurse staffing ratios in California, one of the few states that has these strict nursing ratios, where in the ICU, a nurse can never have more than 2 patients. On a medical surgical unit, may only have 4 patients or 5 patients, depending on the unit, but no more. Well, because of this pandemic and having 50 nurses that are out right now quarantined or on leaves of absences, just the significant shortage that we're experiencing right now, we're having to flex beyond that. We're asking nurses to take 5 patients or take 6 patients. And so we would technically be out of ratio. And the state would come and find us and fine us $30,000 for every incident that we were out of ratio. And they would not allow us to continue it, or they would shut us down if we didn't maintain those ratios. So we just learned this week that the state in 2 weeks is going to reinstitute those ratios unless the hospital can prove that it is under a crisis, that it is, overwhelmed by COVID patients, and that it has shut down all elective surgery. And unless you've done that, you will not be granted a waiver. And so we need that waiver. But at the same time, can we shut elective surgery down, which was devastating to us financially? I mean, right now, because we're so short-staffed, we're asking our nurses, and bless them for their willingness to do this. You talk about commitment and dedication, but they've already, they're tired. They've worked all their shifts, which is usually 6 12-hour shifts in a 2-week pay period. But we're going to them and asking them, would you please be willing to work an extra shift, maybe a second extra shift? And if you do that, we will pay you time and a half for all those hours, and we will give you a $400 bonus for every single extra shift you work. Right now we're paying $80,000 a pay period for those extra shift bonuses paid to RNs. And I'm happy to pay it so that we can continue to take care of the community. But the state has not given us a penny of funding throughout this whole thing. So it's Kaweah Delta that is funding that $80,000, that time and a half, compensation out of our revenue. And if you shut down elective surgery again, we saw the devastating effect it had on our revenue. And so, the state, forcing us to shut down elective surgeries that will cut off our revenue supply, or you know, we're going to institute these nurse staffing ratios and start fining you every day for not meeting them.